Today we are going to talk about sciatica backache. The backache which starts in the lower portion of the back and it radiates to usually one leg is called sciatica pain. Sciatica pain usually occurs when you are lifting some object or you are taking something from the ground and suddenly there is a catch and there is a pain. Usually sciatica occurs when you are doing some activity which you are not in a comfortable position. Sciatica nerve is pinched and it suddenly starts to pain. Some amount of rest gives a certain satisfactory result to this condition, but long-term treatment of the sciatica pain is after the sciatica pain reduces, you have to get yourself to become so fit that you don't develop this sciatica pain. That is, you have to follow certain exercises for the low back ache to get rid of sciatica permanently. In Ayurveda, Paschimottanasana, this asana has been stated for low back ache and sciatica kind of pains, and that helps a long way in treating sciatica. Even Surya Namaskara, when done, when the pain is not present, will prevent further sciatica pain in the future. Whenever you are picking up a heavy object, you should be very careful to position your body properly so that you don't twist and pick up the object. You have to be in the same plane as the object, and in the straight line you have to pick up the object. If it is very heavy, you should avoid picking it up single-handedly, especially when you are picking up a bucket in a position which is putting the weight on only one side of the body. You have to be very careful. In sciatica, hot packs and cold packs also help. Certain hot packs which you can use are sand pack, bags, water bags. They are very useful in sciatica for the time being. But in the long term, you have to take certain nervine tonics to prevent further damage to the nerve and also heal the pinched nerve. And also you have to be very careful when you are traveling in very bumpy roads so that the nerve is not again affected. This sciatica pain often affects people who have long standing work job. So like if you are sitting for a whole day and you are not taking in between breaks or getting up from the seat, it also might result in sciatica. Also, there are certain chairs which are uncomfortable to sit on the whole day, rotating chairs. All these might cause sciatica. Also, certain things causes sciatica. Like for example, if you are running in certain bumpy roads and there is a twist and sudden accidents, all these also cause this sciatica to happen. So, instead of treating sciatica, better to prevent sciatica by getting regular exercises, doing yoga, doing stretching exercises, being flexible, and also taking foods which are little laxative in nature. In Ayurveda, Vata Vriddhi, it is called, any pain in the body is called Vata Vriddhi. So if you take mild laxatives and see that you don't have constipation, then also these pains won't occur, and even if they occur, it will go very quickly. And certain herbs which we can take as an anti-inflammatory are ginger. Even jeera is very helpful for sciatica pain. In the older days, they used to take castor oil for mild purgation in case of sciatica. There are certain medications like we call Gandharvastadi, Kashayas, and tablets which includes Eranda Thaila or castor oil, which helps in backache, even sciatica. You have to rule out certain things when it is a low backache, like urinary calculi and certain other aspects have to be ruled out. But there is a differential diagnosis for sciatica. It is especially when you change the position. When you stand, when you are sitting, you just get up from the sitting position. That pain is called sciatica. And when you are changing a position from sleeping to getting up or changing a position from standing to sitting, there is a certain amount of dull pain. And there is a diagnostic test also. It is called SLR. It's called straight leg raising test which will diagnose whether it is sciatica or not. So these are certain small aspects which I have covered in sciatica. There are other aspects also which you have to rule out when you are considering low backache. So if you have a doubt, you should first consult physician who is nearby, and every Ayurvedic doctor will can guide you to treat sciatica, and also you can take mild massages without pressing that area. You have to be very careful in that aspect. When kati basti etc. can be done, but please do not massage it very badly and injure the nerve. You should be very careful in doing massages for sciatica. But very good medicines are available which can cure sciatica to a great extent. Thank you very much.